Hi, welcome to session 3, and we we shall focus on defining a evaluation of humanitarian action. Yeah, so previously we talked about humanitarian situations and the need for humanitarian action and intervention, and therefore following those interventions to assess their effectiveness and know whether they are creating the impact that is intended. Agencies must commission and carry out evaluation of those humanitarian interventions, and that's what now we refer to as the evaluation of humanitarian action. And so in this session, we aim at defining evaluation of humanitarian action, discuss the purpose of humanitarian action, and define the criteria for evaluation of humanitarian action, and then take a focus on challenges to evaluation of humanitarian action and potential remedies for those challenges, as suggested by the evaluation guide. So, of course, there are many diverse and complex humanitarian situations, and these can be categorized according to the type, the cause, time scope, and frequency of their happenings. For instance, if you have a volcanic eruption, how often does it happen? If there is conflict, what is causing the situation? Even we also talked about the issues of having crisis within crisis, and then type, of course, again, type of the humanitarian situation. Is it a disaster? Is it a crisis in terms of conflict? Is it a pandemic? What is it? Then scope of the area that is affected, and then of course the capacity of the nation or community to indeed address and respond to that situation. So that therefore calls for the need for universal remedy to that crisis, which anytime, anywhere, and that's what we call the humanitarian action. And as we referred to it last time, it's any assistance, protection, or advocacy in response to humanitarian needs, and of course it is to save lives, to reduce their suffering in short term, and preserve their dignity as human beings, but also looking forward to use the capacities to help the communities recover through reconstruction process and recovery processes. And of course, it is done with the main principles of do no harm, which is the main principle for humanitarian interventions, but also following the other principles of humanitarian action, which include humanity, neutrality, independence, and impartial kind of humanitarian action. And of course, the humanitarian action can be done before the crisis happens. So in terms of preparedness and in terms of mitigation, so that they can minimize the impact if preparedness to prevent it is not enough. But humanitarian action can also happen as emergency response if the crisis happens. For instance, with COVID-19, within the middle of a crisis in Yemen or Syria, Democratic Republic of Congo, and so on. And then humanitarian action can also be in terms of helping communities to recover, but also reconstruct to be able to regain their livelihoods. So the timing indeed influences the evaluation scope and the focus, but also why evaluation is needed for its purpose. So what is evaluation? Before we get to to evaluation of humanitarian action, we must remind ourselves what evaluation is. Any systematic, objective, periodic, rigorous, independent assessment of either a completed or ongoing intervention to determine whether the intervention is relevant, or whether it is achieving the intended objectives, or whether it is working or not working is for purposes of improvement, and so on. And therefore, in most cases, evaluation is done to attribute whatever observed changes in to be able to say that, okay, this is the intervention that happened, this is the project that was implemented, and therefore the changes that are being observed in terms of behavior change, of course, at the institutional level or individual level, or micro or macro level, whatever changes that are being observed are because of that particular intervention. Of course, there are, as we shall see in a moment, with these complex interventions, it's sometimes difficult to attribute, but rather assess the contribution. Okay, so the question to answer is, what have we achieved and what impact have we made? Is it because of the intervention or that we have that was implemented or not? So back in 2003 and 2006 defines evaluation of humanitarian action, as systematic, impartial, and examination of humanitarian action intended to draw lessons so that, of course, to influence decision making and enhance accountability. Of course, so systematic, so it's done in a planned way. Impartial, therefore must be independent and not biased, and it examines humanitarian action, so exploring, analyzing whether certain issues were met. Okay, and of course that is done for the purposes of learning, but also accountability as the main purposes for evaluation. So Buchanan Smith, in the guide for evaluation of humanitarian action by UNLAP, and that is, of course, our main document that will guide the whole of this module. So they define it as a systematic, objective examination of humanitarian action, and of course to determine the significance of any humanitarian intervention. And of course, the intention is to get information that can influence policy making and improve on practices, but also for purposes of learning and accountability. So key terms to note, as of course as we have them in our usual evaluation definitions. So inputs, which refer to resources needed for humanitarian action. So consider all those, the monies, funding from donors, and other kinds of humanitarian of other kinds of resources needed for humanitarian action. The activities are the combination of tasks that, of course, are done while utilizing the resources or the inputs that we just talked about. The outputs are the immediate results. It could be in terms of goods, maybe housing, maybe clothing, and so on, or services in terms of maybe health, education, food supply, and so on. Or water supply, and so on, within camps or areas where people, displaced people are living. Outcomes can be intermediate, intended or unintended, or positive or negative results that reflect changes in behaviors at all levels. It could be at individual, or organizational, or institutional. Okay, and of course these lead to the impacts, which are broad effects. Again, they could be positive or negative, or intended or unintended, or micro or macro, and could be short or long term. So as we shall see, of course, while evaluation is taking place, the intention is to see whether the results of the inputs and activities um, and that have led to outcomes and impacts can be indeed attributed to that particular humanitarian intervention. Okay, so like I said earlier, humanitarian interventions are sometimes complex and are reactive to certain contexts, also depending on the timing and resources available. So, and again, also because the humanitarian interventions involve all different kinds of humanitarian actors within the humanitarian system. So sometimes it is difficult to attribute certain changes to a specific intervention. So in that case, evaluations might within some interventions resort to assessing and analyzing contribution rather than only being specific to attribute the changes or observed changes to that particular intervention. Okay, so in that case, the question would be, okay, are these observed changes in terms of maybe reduced number of malnutrition and death of infants as a result of the intervention of food supply and so on, or it is part of the contribution from different facets of different interventions. So in simple way, we can say it is inputs that if the inputs are on, then activities can happen. So the combination of inputs and activities can produce the outputs, which are goods and services. And if outputs are achieved, then outcomes can be achieved, and those are the intermediate results. And then if outcomes are achieved, then they should be able to influence impacts, which are the broad effects that can be realized at different levels. Okay, that's the result chain. But then we are saying, of course, it is from short term to long term. Okay, but of course, remember, as we move from short term to long term, the control of the agencies, the commissioning agencies or the implementing agencies keeps reducing the control of results, and therefore also attribution keeps reducing as we go from short term to long term. Okay, and so therefore at impact level you'll have low attribution because you have many contributing factors and many other interventions contributing to those impacts. And then it is high at short term because there you can easily know that it is the combination of activities and inputs that really resulted in maybe construction of boreholes in refugee camps or improving maternal and child health, okay, because of certain health center that has been constructed within a certain location. Okay, so you have characteristics of evaluation of humanitarian action. It is commissioned. The evaluation is commissioned by or in partnership with humanitarian agencies that are being evaluated. In other words, those that are implementing those humanitarian action. It's executed by internal team. So this is the staff for that particular humanitarian agency. Could be Red Cross. Take an example, or UNFP, or IRC. Okay, think of all those agencies, or it could be external team, which is whereby maybe Red Cross or IRC or UNFP or UNICEF have hired a consultants agency to come and do the evaluation. Okay, or it could be a mix of both teams to, of course, improve the credibility. But of course, usually recommended for external to remove the other, to improve on the level of impartiality, or on the level of impartiality, as one of the key issues that we've talked about earlier. And of course, also evaluation of humanitarian action uses a recognized evaluation criteria. Usually, the criteria is developed by the implementing agencies or the agencies that are commissioning, or sometimes donors also influence those criteria depending on what kind of evaluation or for what purpose. Is it for accountability or learning? But usually, as we shall see later, usually the evaluation criteria that is usually relied on is the evaluation criteria by the OECD DAC, which was developed for evaluation as an evaluation criteria that agencies and individuals and organizations can follow. So also evaluation of humanitarian action analyzes results and makes recommendations for use. So in other words, at the end of the day, if this evaluation is not utilized, then it's for nothing. So that is why it is important that before evaluation is commissioned, the evaluators or the commissioning agencies or the manager, the program manager or evaluation manager must be able to know and identify the uses of this evaluation and the users. And therefore, as we are going to look to look at it later, evaluation of humanitarian action must be utilization focused. Okay, we'll explore that more. So why is it? Why must we have evaluation of humanitarian action? So two main purposes: learning and accountability. So learning so that information can be used as reflections of experiences can be taken up, analyzed so that they can make changes. Okay, so during implementation or after implementation or for scaling up of other interventions that are of the same characteristics. And then also accountability in terms of usage of resources and power, but also being accountable to stakeholders and especially including the affected people. Okay, so so lesson learning and accountability in evaluation of humanitarian action. So you have examples of the types of evaluation types where you have self-evaluation, real-time evaluation, process documentations, and so on. We are going to look at these in session 5. Where we shall be looking at initiating and framing evaluation of humanitarian action. Okay, so in that case, then on accountability side, you have objective-based studies, impact assessment, and so on. So again, of course, the main use, current use is the main focus is on for evaluation for learning is to establish why results were or were not achieved. But for accountability purposes, it's to establish whether those results were achieved or not. Okay, of course, putting in consideration the resources that were available. Okay, and of course, more likely to use the OECD criteria of evaluation, which includes relevance, sustainability, impact, effectiveness, efficiency, and coherence. Okay. So the criteria is right here: relevance and appropriateness of the intervention. Was the intervention relevant to a particular context? Okay, because sometimes, yeah, what we try to avoid the one size fits all. So whatever works in South Sudan, in a crisis in South Sudan, does not necessarily mean that it will work in Rohingya, in Myanmar crisis, or in Syria, or in Somalia, or in DRC. Okay. Also the connectedness between, of course, the different interventions, but also coherence and then coverage in terms of how many people have been able to benefit from from the humanitarian intervention, efficiency in terms of resource use and implementation, and so whether the resources were used as planned. Then effectiveness, whether the intended objectives were achieved, if it was said that the intervention excuse me, of cash transfer to refugees to improve their livelihoods, if that was the objective, then the question or the assessment, the criteria, key evaluation question should be asking whether indeed those cash transfers have been able to improve the livelihoods of those individuals. And then, of course, the impact in a long run, a short or long run. Okay, so what is so unique about evaluation of humanitarian action? What makes it unique or differ from these other evaluations? So evaluations happens in complex emergencies, and of course may be disrupted or prolonged depending on the frequency of and complexity of the evaluation, the intervention. Okay, the humanitarian situation. Okay, there are difficulties. For instance, if evaluation was meant to happen in January, and then in January maybe the conflict escalates, okay, in a certain region, that might actually affect the implementation of evaluation. The difficulties to do objective evaluation due to differences in crisis experiences. Of course, so you have, for instance, the government, the other stakeholders, women, children, old, youth, rural dwellers, urban dwellers. Also, there are different people who are being affected by a certain crisis, and therefore also attaching meanings and interpretation of the humanitarian interventions, and therefore it might be difficult to get an objective evaluation. Okay, then difficulties to get data and access of information, depending on, of course, how the situation is. So for instance, you have let's take an example of the Tigray, Ethiopia crisis. Okay, there are incidents where, for instance, the humanitarian agencies or workers or humanitarian actions were not actually being implemented because the forces could not allow them to proceed. Okay, so such situations, it is also difficult to get data. If, for instance, interventions have been happening, and then the evaluation team is yet to conduct an evaluation, but then they cannot access certain areas. Also, missing indicators and objectives due to quick planning, because these are situations that happen quickly, and therefore you do not have time to wait for certain to plan very well and effectively, just like other interventions. The situations happen instantly, and then the response must happen quickly, but also evaluation of such responses or interventions must happen also quickly to draw lessons for learning. But then that makes it difficult to have concrete indicators and objectives for future measurements. Okay, and that therefore making it difficult for attribution. Okay, so then evaluators may need, of course, interpreters. In most cases, you have humanitarian workers who are from different areas fitting in, trying to help, and therefore the team of evaluators is made up of different humanitarian workers or different evaluators with different backgrounds, and in this case might need to rely on interpreters to fit within the local context. So this is the process of evaluation of humanitarian action. So you decide to do the evaluation, design and initiate the evaluation and budget for the evaluation. There's inception, planning and management of evaluation, how, for instance, data will be managed and how the teams are managed that will be conducting the evaluation. Then the actual implementation of the evaluation and engaging engaging the affected people, and then data analysis, and then reporting and dissemination of evaluation findings. Of course, again, relying on the principle of utilization focused evaluation. Okay, so we are going to look at all these steps, and therefore different sessions focus on these different aspects of the evaluation process. Okay, so for instance, in the next session, we begin with deciding to do the evaluation. Okay, in this session, we are mainly focusing on defining and identifying the challenges of evaluation of humanitarian action. So, Buchanan Smith and Cosgrave and Warner, in their Evaluation of Humanitarian Action Guide 2006, identify some of the challenges and try to provide some of the remedies to these challenges. So one of the challenges is the urgency and chaos of the humanitarian emergencies. That, of course, poses the challenge that it is difficult to get to access information or get data within such chaotic humanitarian emergencies. So one of the remedies is to interview agency staff and to construct the chronology of how the crisis has been happening and how the humanitarian interventions have been happening, to be able to get a background of how things have been happening, to draw a base for how evaluation would be done. Another one is insecurity, which may mean lack of access in conflict environments. Okay, so like I said earlier, reflecting on Tigray, Ethiopia crisis, it might be difficult to access participants or the affected, or where the intervention is happening. So you may use creative ways such as, for instance, using online mechanisms or techniques, but also, if you do that, do not generalize after when you are drawing your findings or reporting your findings. Try not to overgeneralize or generalize, because the context in that case was not scrutinized well, or even triangulation was not done to be able to produce credible information. Okay, so don't generalize. So please also there is a need to present your constraints within the report, so that this can be known that during this time some information was not accessed, and therefore we cannot generalize that, take decisions that are general for certain interventions. Okay, it's a lack of baseline data, because these are quick situations, quick interventions, and therefore quick implementation. So in that case, you could use key informants and engage the affected people to provide a recall kind of recall kind of data to help you situate how things were before the implementation of humanitarian intervention, and then you can base on that to give you that. But also you could draw on how everyday monitoring records have been taken to be able to get information on that matter. There is also high staff turnover because of humanitarian situations. They happen now, tomorrow they are not there, or the humanitarian workers keep changing and moving from one place to another, depending on the context and timing of the crisis, and therefore sometimes because of that staff turnover, you might be constrained to get some information. So in that case, you could use online methods to be able to remotely access those that are not available to be interviewed physically. But also you can use national staff, which always have low rates of turnover, like representative, UN representative not on to Uganda is not often moving or changed to other locations, but these other implementers of humanitarian interventions sometimes move from camps to camps or zones to zones. Okay. Then you have humanitarian crisis in remote locations and with damaging infrastructure. So that itself also constrain accessibility. So you could involve teams that are familiar with the local, with the current situation and local situation, and therefore also consider contingency plans. Okay. There are also uh, conflict paralyzed perspectives. So in that case, use triangulation methods or techniques to gather as many points of view as possible to improve credibility. Okay, but you also present constraints to findings. Again, don't generalize. This breakdown in trust where there has been politicization and trauma. So in this case, for instance, take an example of a situation where maybe the affected persons have lost their family members, and the situation is not handled well. So these affected persons have been stressed, and they are under pressure, and they are feeling traumatized. So in this case, you look for methods that are sensitive, and you consider equity and gender sensitive evaluation techniques. Okay, so that you can be able to handle well such participants. Okay. But also humanitarian aid workers sometimes operate under pressure, and therefore the evaluators need to be sensitive and consider that such pressures may actually hinder these humanitarian workers to be able to respond credibly to certain evaluations. Okay, so you use techniques that are better in engaging these humanitarian workers. Okay, so bottom line is that humanitarian action that lacks credible evaluation poses challenges. Okay, and that this may lead to failure of humanitarian interventions. Okay, and again, there must be consideration of perspectives or viewpoints from all different stakeholders, including the affected people. Otherwise, you wouldn't be able to know whether the intervention has created impact or not. But of course, as we all know, as complex it could be, planning is important. But of course, it is, as we have seen, things happen quickly, interventions happen quickly, and planning sometimes also is quick. But it is very important that planning sometimes is done, especially when before the crisis has happened. Situation in situations where the crisis has not happened, and therefore they are dealing with mitigation and preparedness. Okay, it's very important. These are some of the reading materials you could utilize for further reading, and thank you.